California's COVID surge showing no signs of slowing down. The state seeing tens of thousands of new cases every day, and 3 times as many patients are being hospitalized compared to just 1 month ago. NBC News correspondent Meagan Fitzgerald has more from Los Angeles.
Allison, here in Los Angeles, stay-at-home orders are expected to be extended today. The COVID situation not improving much since Thanksgiving as more states struggle to treat the surge in patients, and officials across the country urge Americans to celebrate the new year at home. Top health officials warning the impact of holiday travel will likely haunt the nation well into the new year.
There is no question we are going to see another surge, just like we did after Thanksgiving. We're going to see another surge in January.
The U.S. adding more than 1 million cases in less than a week. Total COVID infections now accelerating past 19 million. And the CDC predicting the country could surpass 400,000 deaths by mid-January. From coast to coast, hospitals are in crisis. In California, the epicenter of the pandemic, infections are spiraling out of control.
We prepare ourselves for what is inevitable of a surge on top of a surge, arguably on top of, again, another surge.
The Department of Health in L.A. County announcing a tough new travel restriction, ordering anyone who travels outside of the county to quarantine at home for 10 days when they return. Overwhelmed medical centers like Huntington Hospital are inching closer to prioritizing care for people more likely to survive.
This is the worst crisis I've ever seen at our hospital.
In Tennessee, now second to California with the highest number of new daily cases per capita. Many critical care nurses are seeing patients die on every shift.
We are working so hard and working to support our team, and we need our community to support us.
Meanwhile, growing concern over a slow vaccine rollout. The CDC estimates over 2 million have been vaccinated. That number likely undercounted due to the reporting lags, but still far short of the 20 million originally promised by the end of the month.
It's probably realistic to think that the pace is going to be a little bit slower, especially as we try to move through hard-to-vaccinate populations next month.
Some positive news, nursing home residents and staff joining frontline workers and first responders in getting a shot of protection in a battle that's far from over. More help could be on the way. On Monday, Novavax announced the start of phase 3 trials of its vaccine candidate, the 5th company to launch a large-scale trial here in the United States. Allison?
More than 19.4 million confirmed COVID cases, at least 336,000 lives gone, over 121,000 people in the hospital. It is hard to imagine the COVID situation in our country getting any worse, but it could by next month.
Once you get to large numbers of people at a dinner, inside, poor air, ventilation and circulation, that's when you get in trouble. And that's what we're concerned about, that in addition to the surge, we're going to have an increase superimposed upon that surge, which could make January even worse than December. I hope not. I hope that doesn't happen, but it certainly is possible.
NBC News medical contributor Dr. Natalie Azar joining me now. Dr. Azar, it's great to see you. We keep hearing that January could be even worse than December. How concerned are you about what's to come in the new year?
Oh, Allison, I am very, very concerned. I don't know how people are going to approach the next few weeks. I certainly hope that nobody is feeling any sense of false security because we have started vaccinating, a small percentage of the population. But just as Dr. Fauci mentioned, it is a perfect storm ripe for transmission. Cold temperatures, holiday gatherings, indoor, crowded. This is exactly the kind of setting where we see the virus just absolutely flourish.
Dr. Azar, Colorado has reported its first case of that new COVID strain out of the UK. What do we know about this case, and what are you worried about here?
Well, it's interesting because when I was thinking about what we were going to talk about tonight, I was going to mention that there was a great likelihood that we probably already had the UK strain here, which is just going to tip the equation into more transmission because we know that this particular variant is about 70% more transmissible, which just means that it's more contagious. Yeah. People will be able to spread it even more easily than they were spreading the original variant here. What we do know about it, Allison, is that it does not appear to be more pathogenic. That is, it does not cause more severe illness or more likely to lead to death. And we also have evidence at this juncture that we believe that our vaccine is protective against the variant. But given the fact that it is so transmissible, even more, we need to emphasize how important it is to keep on wearing your masks and keeping your distance and washing your hands. I know people are getting very tired of hearing it, but unfortunately, we need to double down on that now.
Dr. Azar, this pandemic has been just an incredible reminder of the injustices and the inequality in our healthcare system. This story we're about to share with our viewers is just devastating. Dr. Susan Moore, a Black physician, died from COVID after saying that she was getting inadequate care. Here's a video that she recorded from her hospital bed before she died.
You have to show proof that you have something wrong with you in order for you to get the medicine. I put forward and I maintain, if I was white, I wouldn't have to go through that.
Dr. Azar, if a Black doctor cannot get the care that she needs, I mean, what does this tell us about the treatment? The average person with no medical knowledge or expertise, the poor Black person, is getting in our country. And how do we start fixing this so broken system?
I know, Allison, I read this story a few days ago, and I was in such disbelief, but perhaps I shouldn't be, given the fact that it is well established that Black people and other minority groups in this country are known to get inadequate or subpar care. They also are more likely to die prematurely than their white counterparts. This is something that has been known for decades. There have been some improvements made here and there, but clearly it is still an ongoing problem. And the thing is that most healthcare providers wouldn't consider themselves explicitly racist. However, many of them do have subconscious prejudices. That's called implicit bias. And this is prevalent. Yeah. I would argue that it really starts with medical school education. I mean, it certainly starts well before that, more broadly speaking. But if we're talking specifically about healthcare, it begins with medical education, and it really needs to be part of institutional policy that this kind of behavior is named, it's called out, it's identified, and it's changed.
Yeah, Dr. Azar, you bring up such a great point that it's so important that it starts, if not sooner, but at least with educating our doctors and at medical school. It's something we quite haven't talked as much about on our show. Thank you for bringing that up. I have to ask you about our rate of vaccination. So far, the CDC is saying just over 2 million Americans have gotten the COVID vaccine, and we know that's just the first shot. By our own NBC News analysis, at this rate, it would take 10 years to inoculate enough Americans to get COVID under control. Now, I know we are just getting started here, but what are your thoughts about how things are going so far? Is our vaccination timeline way off here?
Well, it is, and I don't know if the number that they originally wanted, the 20 million individuals vaccinated by the end of the year, was truly aspirational or not. What I can tell you is that given what President-elect Biden was saying today, that he would very likely invoke the DPA in order to speed up manufacturing and launch a very aggressive public health campaign around education, around the safety and efficacy of the virus, I think the vaccine, that's going to be incredibly important. Experts have really pointed to the fact that while we had a great federal, operation to manufacture the vaccines, the distribution and the execution of them really was left to the states with inadequate funding and a deficient public health infrastructure with which to carry it out. So I do think we need to accelerate. I think everybody clearly knows that we need to accelerate accelerate. And, you know, I do feel optimistic that we can do it, but we certainly have started at a very, very lackadaisical, you know, speed at the moment. Not adequate.
A lot of tough topics today. Dr. Azar, thank you so much for talking through them with us. We always love to see you.
Thanks, Allison. You too.
It's a big day for Beatitudes Campus, a senior living community in Phoenix, Arizona. Residents there getting their coronavirus vaccines today. NBC News reporter Vaughn Hilliard there for the big day. Vaughn bringing hope and sunshine to our airwaves once again. I know this community had an outbreak just last week, so let's talk about the timing of this vaccine. I imagine it just could not come soon enough.
Allison, you're right. Every day matters. Just in the last week, there was an outbreak of more than a dozen residents contracting COVID here after months of successfully staving off a spread within this community. And we should note here, this Beatitudes campus here in the heart of Phoenix, 700 residents. And yet, dating back to March now, just look at that on the timeline. We're talking about 10 months for a good chunk of this community. They've been mostly isolated. And that's why I want to introduce you, Allison, to this couple that I can tell you after a couple hours already mean much to me, and I think have connected with people because in so many ways we don't know what each other have gone through over these last months. And that is why I think listening to this couple's story, I think is important. Take a listen. This is Hootie Redwine and her partner of 39 years, Peggy, is up on the 3rd floor, isolated in a skilled nursing facility. They've been apart since March. Take a listen to Hootie talk about what the arrival of vaccines today meant to them.
Peggy's going to be getting her first vaccination, and it's like you waited for something for all these months. You didn't know what it was, but it was out there somewhere, and it's today. It's here, and it's you know, there's going to be another good side to this pretty soon, but today I can kind of remember what hope is like. We kind of didn't have that for a long time, but I think Peggy would say the same thing, that we were rediscovering hope.
And just a bit ago, we were there as Hootie was FaceTiming with Peggy as Peggy got that vaccine. This is the Moderna vaccine. So the second dose is coming in 28 days, and you can bet there is a countdown that has begun here in Phoenix, Allison.
Oh my goodness, Vaughn, so excited for Hootie and Peggy and all the other families, couples, people who just have that hope again, as she said. What is the rollout plan for this community? How many doses is Beatitudes getting?
Exactly. I said there was about 700 residents today. About 75 staff got their doses, their first doses, but then 38 residents. Those were those residents like Peggy who are in more critical situations in which they are in that skilled nursing facility. And so the plan is to continue over the course of the next month to get them even to the likes of residents who are more independent living, are able to roam more freely. I want to let you, though, hear directly from the CEO, who's been here from a number of years, talk about what these senior facilities like Beatitudes Campus have gone through and what these communities truly are. Take a listen to CEO Michelle Just.
So many of the staff here, this is our family. The residents are our family. And to be able to witness residents interacting with their loved ones while they're getting the vaccine is very emotional for us, too. We've walked this journey with them, had to be their family for the last 10 months. And we're all just incredibly grateful that this day has arrived.
Allison, it's been a long 10 months, and hopefully over these next months, as more and more get the vaccination, we're better able to reconnect with folks and talk about what people have been through, what the likes of Peggy and Hootie have been through, Michelle have been through. This is a process that is going to take months and a good conversation for us all to listen to. Allison.
Vaughn, we have all needed a little bit of hope this week, and you have brought it 2 days in a row, if I'm not mistaken. It's easy to lose track of time these days, but thank you so much, my friend. We are grateful for it.
Thanks, my friend.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.